Hi, and welcome back to A Guide to Surviving Stroke and Brain Injury. We're in number 5 of our series of strokes that you can have. Number 5 is temporal lobe, and so excuse me again, but I have notes. So I don't want to mess this up, but it's important, and I'll explain in my conclusion. So a temporal lobe is the second largest lobe in the brain. It's located behind the ears, and it comprises the lower region of the brain. Temporal lobe strokes are caused when a blood vessel in the temporal lobe becomes clogged, ischemic stroke, or bursts in this area, otherwise a hemorrhagic stroke. Blood is rich in oxygen, which fuels cellular activity. When the brain doesn't receive a sufficient supply of blood, those brain cells start to die. A stroke is a medical emergency, and it is crucial to receive medical attention as soon as possible to restore blood flow to the brain and decrease the severity of the side effects. The side effects sustained after a temporal lobe stroke depend on speed of treatment, the size of the stroke, and other factors. The side effects are: it affects the function of the temporal lobe, which includes memory, language, and emotion. Here are the 6 most common symptoms and side effects of a temporal lobe stroke. Poor memory. The hippocampus is a structure located inside the temporal lobe that is primarily responsible for learning and memory. A stroke in the temporal lobe can affect past memories and the ability to learn and retain new information. Inability to recognize faces. Sometimes I wonder if I have had a temporal lobe stroke, because a lot of this sounds kind of familiar. But the temporal lobe also plays a large role in perception. As a result, some temporal lobe stroke survivors experience a condition called prosopagnosia. With this condition, they may not be able to recognize faces, even familiar faces or family members. Experts believe this occurs due to impaired memory and perception skills after injury to the temporal lobe after a stroke. The third is impaired speech. Temporal lobe spans across both sides of the brain and is divided in 2 halves, similar to the rest of the brain, referred to as the brain's left and right hemispheres. If a stroke occurs in the dominant side of the temporal lobe, it may affect the Wernicke's area. I hope I'm saying that right. This part of the brain controls verbal and visual language skills. When this area has been damaged by stroke, the survivor may struggle with speech difficulties known as aphasia, which I have. Specifically, they may sustain Wernicke's aphasia, which is also called fluent aphasia. With fluent aphasia, the survivor may be able to speak fluently, but may use the words wrong. Here's the difficulty with depth perception is number 4. While most visual disturbances after a stroke occur when the visual cortex has been damaged, a temporal lobe stroke may cause problems with perception. Some temporal stroke survivors experience difficulties with depth perception or experience field cuts. Now, I have a problem seeing depth perception. I step off curbs. I don't know how tall or small they are. Potholes, changes in like if it goes from asphalt to cement or cement to dirt or whatever. I have a problem seeing that. With field cut, the patient cannot see their field of vision in the affected side. Field cuts are different from hemi-neglect. Number 5 is trouble with sound. Temporal lobe strokes can impair one's ability to process and recognize sounds, because the primary auditory cortex is located in the temporal lobe. The brain needs to derive meaning from the sounds in order to have them have significance. Temporal lobe stroke survivors may experience difficulties recognizing sounds or locating where they're coming from. Number 6 is emotional and behavioral changes. Again, sorry if I'm butchering this, but here we go. The amygdala is located inside the temporal lobe and is responsible for emotional responses. Interestingly, a stroke in the temporal lobe can affect emotion in different ways. Some may experience more aggressive behavior after a stroke, while others may become more passive. This illustrates how every stroke is different, even when it occurs in the same area of the brain. Instead of trying to predict which emotional or behavioral changes stroke patients may experience, it's best to take action to address what does happen. Rehabilitation. Because temporal lobe strokes affect every brain differently, treatments will vary based on the symptoms experienced by each individual. That's why it's so important to know what kind of stroke you have. Here are some types of therapy that may help recovery after a temporal lobe stroke. Speech therapy. It may guide stroke survivors to overcome all types of aphasia, including Wernicke's aphasia. Practicing specific speech therapy exercises helps patients relearn the particular language skill that was impaired. Cognitive training may improve memory in some patients. While memory is not guaranteed to improve, cognitive training is known to improve recognition, which may help patients recognize faces again. Vision restoration therapy. It may improve vision after a stroke. While most research is needed in this area, Nova Vision is a new and emerging concept. Positive psychology, which in every stroke you need positive psychology. It can help retrain the brain to experience more positive emotions. If a temporal lobe stroke produces negative emotional changes, positive psychology trains the brain to experience better emotion. Psychotherapy may also benefit survivors of temporal lobe stroke. It may provide new ways of coping with significant life changes and difficult emotions after stroke. Audiology. Audiologists can fit you with a hearing aid if you struggle with impaired hearing after a stroke. A speech-language pathologist may provide recommendations or other methods to improve hearing after a stroke. These rehabilitation methods promote recovery through the phenomenon of neuroplasticity, the brain's ability to continually adapt and reassign functions affected by stroke to healthy regions of the brain, which in every stroke, again, this is important. Neuroplasticity is important. It's activated by mass practice. While 1 or 2 therapy sessions may not provide results, consistent stimulation may help temporal lobe stroke patients regain lost skills. There are many therapies and treatments available to recover from a stroke. Talk to your therapist for recommendations or continue your own research online, which I did. The key points of this whole stroke thing, temporal lobe stroke, it may affect the ability to recognize faces and form memories. It can also result in fluent aphasia, where the patient can speak fluently, but their words get mixed around. Sorry. While the side effects of a stroke in the temporal lobe may feel confusing to patients and caregivers, there is hope for recovery through neuroplasticity and rehabilitation. By stimulating the brain with therapeutic activities, survivors may help regain lost function. My biggest point in all of this is never lose hope. Never stop trying to be better. Never stop trying to get better. And always have faith that you'll return to the person you used to be. Now, there's no guarantee that you're going to be returned. But I'm celebrating my 6th stroke anniversary in November. And see me now compared to what I was. I wish you guys could see where I came from. But, I mean, I've made big, huge strides. And I have the same hope and faith that you will too. Never give up. Celebrate every victory. And always keep pushing yourself. As always, leave a comment if you have questions or concerns or just like the video. And I'll talk to you soon. Bye.